Health Evolution podcast, where we are talking today about how policy is impacting mental health services, how they're provided, as well as system changes and requirements for different care models. Our guest today, Cathy Gilbert, currently works as a consultant to providers, but she has a history of working in big insurance groups, working with provider network development and operations. She has done a lot of research into different policies that are currently impacting our field, and we are going to dive more into that today. So, I'd like to highlight some information to get us started thinking on this. One of the big policies that will impact the conversation today is the Big Beautiful Bill Act. This is known to be making cuts to Medicaid, to SNAP, and to Affordability Care Act, offering lower cost healthcare options to many Americans. And NAMI, the National Alliance for Mental Health Illness, or the National Alliance for Mental Illness, released this about the bill. Their statement was that they are cutting Medicaids for millions of Americans, and they say they're concerned about the mental health care that will not be afforded to millions of people with this bill and will have a far-reaching impact. But we're going to dig into that a little bit more. And before this bill, there were also some other policies, and we might dig into these as well, that 2026 would dissolve the Substance Abuse and Mental Health Services Administration, also known as SAMHSA, and the Health Resources and Service Administration, or HRSA, consolidating them into a new administration for a healthy America, as well as additional federal actions impacting access to mental health care, included reduced funding for LGBTQ plus crisis services through 988 Suicide and Crisis Lifeline, and halting the 1 billion in school mental health professional grants by the Department of Education, citing civil rights concerns. And all of this was documented from the APA, which is the American Psychological Association article titled New and Proposed Policies Affecting Access to Mental Health Care. So that's going to be our focus today, is looking at these policies, looking at how they are going to specifically impact mental health care, and getting some of Cathy's expertise on this. So, Cathy, I just want to say thank you so much for being here.
Oh, nice to be here, Rachel. I'm looking forward to the discussion.
Awesome. So let's dig in. First, I just want to say all of these changes seem to be moving really fast. I'm wondering from your perspective, is that just how it feels, or are things actually moving at a faster pace than they have previously in terms of policy changes for our industry?
I think with the big, beautiful bill, things are moving really fast. So, for example, um, I'll be dating myself, but I did my master's thesis on national health care in the US in the 90s during the Clinton administration. And
Ah,
we finally got it in the 2000 teens under the Obama administration. So nearly 20 years later. So it
mhm.
took 20 years for that change when that discussion started, even before then, really. And it felt like, ACA wasn't perfect, but it had a lot of the elements that helped us get to where we needed to be.
Yeah.
Um, so yes, and now with some of the changes aren't immediate, but things seem to be moving extremely fast because especially behavioral health, change is slow.
I
It takes a long time.
yeah.
So yeah, this does feel a lot faster. Um, and and I don't think it's still settled yet on how fast some of these changes are going to happen.
Mm, yeah, yeah. So, with that, I would love to hear your perspective. How are you looking at these various policies? What do you see as the big things that we need to be looking at and addressing in the mental health industry?
One of it is part of it is more general. I see it as just the sheer numbers of people losing healthcare coverage over the next 10 years based on the bill. That's huge. A lot of those that lose coverage, I think, will be individuals with mental health challenges.
Mm,
So, because of the work requirement. And when you think about this in perspective, something else that's happening in the administration is the dismantling of the Department of Education, which funds training programs for persons with disabilities who now have a work requirement, but the training programs may not be there any longer. So I think it's even broader than what people are realizing right now. That so that cover that's part of what we have to think about. Plus, there's in the mental health world for people under ACA coverage or Medicare or Medicaid, all three of those are significantly impacted by this bill. Um, those are usually our most vulnerable populations, the people that could use the additional supports. So if they're losing coverage, programs are curtailed, not just in mental health, though that population is going to struggle even more. So, looking for innovative ways to continue to deliver those services, make sure people have the right supports, and keep it and try to keep those support systems, those safety net systems intact.
oh,
Um,
I,
so, when you think about the whole perspective, that's my big concern.
well, yeah, but I think about providers with that,
Mhm.
like whether it's a
Mhm.
non organization, right,
Right.
that might be losing grant funding, or
Hmm.
whether it's practice, a medical practice.
Hmm.
Um, those typically aren't people that have the means to pick up rates or
Exactly.
services for free or
Yeah.
low cost.
Right.
Mm,
Right. Right.
yeah,
Yeah. Because the other concern is how are states going to be able to manage the cuts in what the federal government portion on the Medicaid dollar? It's a pretty significant portion for most states of
mm,
what dollars come from the federal versus the state match to fund the Medicaid safety net programs. I'm concerned that there will be rate reductions in how providers are reimbursed, not a total loss, but rate reduction. So will they be able to cover costs? Um, in mental health, the other thing I worry about is, mental health in the medical world, in the healthcare world, has been one of the lowest reimbursed areas historically. It has not kept up with other specialties, and if those rates are reduced yet again, that's not sustainable.
mm-hmm. Where do you think the
So
rate is going to come from?
I think it's got to be a combination. There's a lot of a combination of public and private dollars, which is kind of where ACA went. um, a combination of, looking at the legislation and being able to understand it. I get really concerned about this. It feels like almost a slash and burn mentality instead
Mm,
of really looking and evaluating programs specifically and looking how to improve those. I mean, honestly, everybody in the healthcare world has concerns about, fraud, waste, and abuse, which is part of what they were trying to get at with some of the requirements they put in.
yeah,
But 99.9% of people that go into behavioral health in the healthcare world aren't going into it for the money. They're going
no.
into it because they care. And so when they talk about all the slash and burn because they're going to save because people are abusing the system, I'm like, where are you seeing that? It's so small
Hmm.
comparatively. So, so yeah, I'm not sure. There's so much that remains to be seen
Yeah.
on all the pieces
Mhm.
of this bill. It's like they cancel, like I said, they canceled, they're cutting this and requiring work, but they're also cutting the Department of Education on training programs. Okay, it doesn't work when you have individuals who need support. And
Hmm.
that's a large group of the mental health. My husband actually was a vocational rehab counselor. Um, he's since retired. And he worked with that population, helping them get jobs. That program that he worked in was funded through the Department of Education.
Hmm.
And he worked with the individuals with disabilities to help them get jobs, many of them with mental health challenges.
Yeah. 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 I hear you that it's going to have a bigger impact than just what we see. Yes,
And,
people are losing medical coverage and
mhm, mhm.
yeah.
Right.
I even think about, society impact, right? If people are getting support with mental health concerns and able
Hmm.
to work in a clinic or whatnot,
Hmm.
that prevents a lot of maybe maladaptive behaviors or other places where that's going to come out and affect our communities.
Right. Right. The other challenge I'm seeing with the big change is its administrative burden that it's added with eligibility redeterminations moving to every 6 months. That's huge. It's hard for first, most organizations and states don't have the resources to process that often. And
Mm,
two, it places also a burden on the individuals receiving the services to actually know what they need to do to revalidate even more often.
hmm hmm Yeah, I mean, yeah, that's doubling what you have to
Right.
do,
Right.
reevaluate that process. And yeah, we all know Medicaid specifically doesn't even tend to be a fast process, even once a
Mhm.
year.
Right. And then in addition, in states like New York, for example, where you have their Medicaid programs and ACA programs are available to legal immigrants to our country, they've slashed that. That takes a huge portion of people, adding more people without coverage and access to care.
Yeah,
Not
yeah.
even just citizens, it's also legal immigrants and helping them get started and get settled in this country.
hmm hmm I am hearing, like having trouble hearing all of what you're saying sound wise. I'm wondering if you're hearing that on your end or if it
A little
seems
bit,
like,
I'm hearing that a little bit with you as well.
oh, okay. I wonder if it's our connection.
I'll
Mine.
check my message. On my just
What are your thoughts? We should keep going.
Correct earlier, but then
Yeah. Okay. We'll just try to keep going. Um,
okay,
and I might ask you to repeat something if
okay,
we have it's a little bit hard to hear. Um,
okay.
I love this conversation. Um, so I know you have a lot of background also working with, well, actually let's wait on that. I'd like to talk about your consulting work. What types of clients do you work with? And I'm curious what you're seeing with them with this policy. Like what kind of
Okay.
conversations are you having? What are you telling people that they should be thinking about? What does that look like?
Well, I work with a lot of clients in the digital health space. So either virtual care or hybrid, which they also may offer in-person care in
Mhm.
some markets. So a combination of those. And and plus a couple more traditional behavioral health settings. Most of my clients are in some way tied to behavioral health.
Okay.
So I have a few that are, more in the allied therapies. So occasionally something different, but for the most part in behavioral health, which is where my career has been is primarily behavioral health. I started out as a social worker, so I have that going all the way back to early career.
Yeah,
Um,
yeah, that's cool.
and what I'm telling them, one of the things, there is a piece of the legislation that actually is good for
Hmm.
virtual care providers. Um, and it could be good because that may be where some things move so that people can have affordable and health insurance coverage. Is there was a provision during COVID that allowed health plans or self-employed self-insured employer groups to allow virtual care or telehealth to be covered um, without having to meet the deductible and or pay the co-insurance copay
Mm.
could be waived for telehealth visits. They lumped it in with preventative care and they waived that. There is a provision in the big bad beautiful bill that does make that permanent, that allows benefits to not require deductible to be met to pay for virtual care visits. So in all of that, there's a positive. I was
Yeah.
trying to find some. So that's good. But there's another issue that's not addressed in that bill or that act now that there's a requirement in mental health and substance use for an in-person visit every 6 months or a year when implementing telehealth. That expires September 30th. Congress has not acted to change that yet.
Mm,
So but you kind of need both.
kind of
So
do. Yeah.
so we're waiting to hear on that other piece, but it is good, especially for individuals that have those high deductible plans, which a lot of companies have gone to make at least some insurance affordable to members. So, so
Right.
that's one piece of maybe good in the legislation. And since I work with a lot of digital providers,
Mhm,
that's we're excited about that piece. That's good news.
mhm,
Because some of those are programs and programmatic where their payment structure is for a program and somebody with a high deductible health plan. Those high deductible health plans have deductibles of $2,500 to $5,000. So if you're going for care, unless you have something major, it's a long time till your health plan kicks in.
mhm. That is a long
So
time.
when
Yeah.
you think about in perspective, I
Mhm,
mean, it's across all health services that you receive, but still,
mhm,
that's
mhm,
that's a big deductible, and it allows for more services to be paid out of health savings accounts, so without impacting health savings accounts. So the way it's set up seems like a positive for employers and employees with coverage and having that covered basically from day one.
Okay. Okay.
So so there's a
Good.
positive.
Yeah. Anything that you think is important for solo and group practice owners to be aware of? Maybe, you're talking about working with a lot of virtual folks, but
Mhm.
even
Mhm.
folks that
Yeah.
are seeing clients day to day. What are your thoughts for that?
They need to just be aware of monitoring coverage, especially if they participate with Medicaid and ACA plans, that to be aware and maybe support their patients in that recertification and reminding them and helping them to maintain their coverage. I mean, that's one piece. Also, to monitor for, watch for changes and how coverage changes, because I think benefit plans are going to change a little bit. Um,
Mm,
so monitoring for what services are covered. I think basic mental health services, I mean, the standard codes are going to continue to be covered. But one of the things I noticed is there's a mandate under a number of the ACA plans for a minimum level of copayment collections. I think it was something like $35. Um,
mm,
so copayments may change. There may actually be times when you were used to there being no copayment. Now there's a copayment.
okay.
So really being aware, continuing your eligibility checks and benefit verifications. Most of those are electronic and sometimes it's hard to keep track of, but just keep re-verifying that, I think is going to be really important. The other thing I noticed, I think is critical, especially if they participate with some of the Medicaid plans. Um, they used to be that for Medicaid in most states, when people were getting enrolled, they could retroactive up to 3 months
Mm,
coverage. They've reduced that to 1 month in that
okay.
bill.
Mm,
So when you're used to, as people are in, getting enrolled in Medicaid, especially if that's a population that you see, if somebody's applied, they would retroactive it and it takes them time to process. So sometimes that 3 months gave them time to get it processed and they'd retroactive it back to the application date. Now they're only going to be able to go back a month,
Hmm. Yeah.
which can make a difference, a significant difference, because I'm concerned about application processing taking longer and that would also impact those redeterminations of eligibility every 6 months.
Mhm.
Those get delayed, somebody could lose coverage. It could take a while. Then they would only be able to retroactive it back a month to reinstate coverage,
Yeah.
potentially.
What is your recommendation for how often to check for eligibility and if there are changes?
Um, I mean, you should ask the patient at every visit, and I think that's pretty standard. But I would almost check monthly just to, you know, make sure nothing changes. And that's about how often things kind of change on a Medicaid role. And even if somebody's employed and changes jobs, usually you're at least covered till the end of the month. So,
Mhm. That's true. That's true.
so thinking about just figuring out a way to kind of do some re-verification,
Hmm.
on a regular basis.
It's good. That's good concrete advice. I like that. So you're not backpedaling or caught
Mhm.
on those kinds of things.
Right, because those individuals may be individuals that aren't going to be able to pay that bill.
Hmm. Right.
So so I mean that's that that would be one of the things I would really look at. I'm also concerned about, from the health plan perspective, them being able to maintain networks, because if you're in a market where you can stay with just commercial and private insurance, or private pay,
Hmm.
um, it's going to even make access more challenging for those individuals that don't have that available to them.
Yeah, I see that too. Definitely makes all of that challenging.
Hmm.
We are about out of time for this
Hmm.
episode, and I'm wondering if you could highlight one critical piece of information for people to know. What would be your top line policy takeaway that folks should know about?
Um, oh, there's so many points. I
Me
think
too.
it's really
I'm
to pay
asking
it.
a hard
Yeah, it's really to pay attention to what the changes are. Um, Watch those communications from the health plans you participate with.
question.
So, because they're going to be telling you how they are implementing the requirements of the changes. So, my takeaway from all of it, as things settle out and health plans figure out what's going on, and even the state Medicaid associations, really watch for those notices. Not just what's in the news, but watching for those direct notices that plans do send out. And I know it's easy to ignore those because you can get bombarded. But I think in this time of fast change,
Hmm.
especially for small individual and group practices, really pay attention to those notices as things are settling, and they'll tell you what changes are and coming in coverage and how they're, because it could change some processes. It could, change, could mean rate changes, could mean a whole variety of things. So I think when things are moving this fast, it's really critical to watch for those notices or try to monitor the payer websites, because that's where they're going to put stuff. That
I
would be
love
my.
to. Yeah, because with information, we can make better decisions. So,
Right,
right.
right. Because you don't know exactly. It's going to be, Medicaid's going to be slightly different in each state. Each state's
Mhm.
impacted differently. Um, and health plan changes. Each plan is going to have to figure out how they're going to account for the changes. I mean, Elevance and Centene in the last week have come out with a restatement of earnings. I'm sure it's coming from United. It's going to be coming from all the major players who are involved in ACA, Medicare, and Medicaid, which all of the major players are.
Yeah. Yeah. Awesome. Well, Kathy, thank you so much for being here and sharing in this conversation about policy changes for the mental health industry. Your
Mhm.
perspective has been awesome, and thanks for the concrete takeaways too.
Okay.
So we'll wrap up this episode
So,
and we'll hope to hear you back next time.
sounds good. I enjoyed it. Have a great
Thanks.
rest of the day.